Signs that your liver is dying. Dangerous. Indicators of fatty liver. How to identify hepatic cirrhosis symptoms in their early and advanced stages. Fatty liver poses a silent danger. Perilous. How do you feel when your liver is fatty? Here are the warning signs of hepatic status that alert us to the fact that the fat in our liver is already causing problems, along with advice on how to get rid of this fat before it's too late. Today, I'll talk about fatty liver, a disease that is rapidly spreading throughout the world. In the 1990s, hepatic cirrhosis was uncommon, but it's more common than you might think. In fact, it affects children in the US. 30% of adults over 35 are affected. And don't believe it's a benign illness because, if left untreated, it can cause liver damage. Cancer as well as cirrhosis. Just to give you a sense of the scope of the issue, one of the leading causes of liver transplantation worldwide is cirrhosis. You won't want to ignore this. You need to catch it early because the liver is an organ that can regenerate itself entirely up to a point. By being aware of the disease's signs and symptoms, you can stop it from getting worse or even reverse it, leaving your liver clean. However, I won't limit my discussion to these signs and symptoms. I'll discuss a food that is the primary contributor to this liver fat. And you must completely avoid having it and not include it in your life if you already know you have it or suspect you might. Mouth any longer, and I'll also demonstrate how this issue can be resolved naturally by making some dietary changes. You'll also learn that the greatest treatments for fatty liver may be found in your kitchen rather than a pharmacy. Indications. Fatigue is one of the 6 initial symptoms of fatty liver. The liver is a vital organ that does vital processes like producing energy and metabolizing nutrients, but the presence of fat in this organ can seriously impair these processes. Additionally, steatohepatitis, a disorder where fat builds up and liver inflammation occurs, can make you feel more exhausted. Liver dysfunction also affects hormone production, which has a direct impact on mood, sleep, and overall body energy, making fatigue a persistent state. The second initial symptom is heartburn, which is accompanied by stomach pain. A study from the University of Florida demonstrated that dyspeptic symptoms, such as burning heartburn that radiates from the belching from the chest to the throat and experiencing a full stomach more frequently than those without this illness, with a significant difference of 25% compared to 12.4% for the third initial symptom of excess gas. Hepatic steatosis patients frequently have an excessive buildup of gases in their bodies. Radiologists observe that this issue may arise from the liver's fat content, which even makes it more difficult to visualize the pancreas during exams. This extra gas is most likely the result of pain on the right side of the abdomen, close to the ribs, is the fourth initial symptom of changes in the intestinal flora that directly affect liver health. Where the liver is located, there is either a light weight or discomfort in the upper right quadrant. A persistent pain under the ribs that is most likely caused by the liver expanding, which can also press on the phrenic nerve and cause discomfort in the right shoulder. Fifth initial symptom: appetite loss. Metabolic changes may cause a person with fatty liver to lose their appetite. Symptoms such as nausea, abdominal discomfort, and psychological effects associated with liver inflammation and hormonal imbalance. These liver-related factors have an impact on how one regulates their appetite and sense of well-being, which highlights the necessity of regular medical checkups for the appropriate management and treatment of this condition. Sixth primary symptom: nausea. When there is fatty liver or hepatic steatosis, nausea can occur for a number of causes related to compromised liver function. First, the liver's capacity to filter toxins is diminished, which causes these chemicals to build up in the blood. Moreover, too much fat in the liver can lead to liver inflammation, which can result in blood causing nausea. Stomach ache or discomfort combined with nausea. The impact of liver dysfunction on digestion, particularly in the generation of bile required for the breakdown of fats, is another factor. Lastly, the liver's enlargement may press on the stomach and other organs, causing nausea and a fullness feeling. These 6 symptoms point to early hepatic steatosis and indicate that the liver is not functioning normally. What are the 11 late signs of fatty liver that you are unable to detect? Disregard the initial delayed symptom: itching throughout the entire body when liver disease is advanced, and there is an accumulation of biosalts in the blood, which can deposit on the skin and cause severe itching. This itching is most common on the palms of the hands but can spread throughout the body and cause discomfort, which is the second late symptom. The liver is affected. Yellowing of the skin. The buildup of bilirubin, a yellow pigment created by the disintegration of red blood cells, results in jaundice. Typically, the liver functions as a bilirubin. However, if he has liver disease, BAR obstruction, or a rise in the breakdown of red blood cells, bilirubin builds up, giving the skin and eyes a yellow tint that is a crucial indicator of a number of illnesses. Third, late pale stools are a symptom of hepatic cirrhosis, which occurs when the liver is unable to properly process biosalts that are necessary for giving stools their distinctive color. This indicates that the liver is having difficulty carrying out its regular functions. The fourth late symptom in hepatic cirrhosis is dark urine. This occurs when the liver becomes inflamed, releasing more bilirubin into the bloodstream. The kidneys filter this bilirubin, which is then excreted in the urine, increasing its concentration and darkening its color to a cola-like shade. Fifth late symptom: body-wide red spots. A reduction in the amount of vital proteins for blood clotting may occur when the liver is unable to produce thrombocytopenia, a condition affecting platelets, and issues with fat-soluble vitamin absorption. It is common for red spots to appear on the skin as a warning sign for these hepatic problems related to clotting and the absorption of essential nutrients. This failure includes vitamin K deficiency, which is vital for clotting. Sixth, delayed sign: spider veins and imbalance in hormones can cause the body to experience an increase in when too much estrogen is produced and is not properly metabolized, blood vessels enlarge, a sign that there is an imbalance in the hormones that affects blood flow. Gynecomastia is the seventh late symptom, and in relation to that hormonal imbalance, gynecomastia, a condition in which men's breast tissue enlarges, may be an indirect result of hepatic steatosis, a condition in which the liver accumulates excessive amounts of fat. This accumulation can disrupt hormonal balance, particularly the relationship between estrogen and testosterone, resulting in the development of feminine traits like gynecomastia, which are frequently associated with such as diabetes, obesity, and heavy alcohol consumption. Gynecomastia in this context represents more general metabolic and hormonal imbalances linked to liver health's eighth late symptom, as hepatic cirrhosis hinders the liver's capacity to metabolize hormones appropriately. Palmetto. The characteristic redness of Emma Palmer erythema, which is caused by the dilation of blood vessels in the palms of the hands, can reflect a number of conditions, such as hormonal changes or liver problems like hepatic steatosis. In the context of liver diseases, the damaged liver may not function properly, produce a hormonal imbalance through hormone metabolism, which in turn causes blood vessels to dilate. This sign suggests that there may be an underlying condition affecting liver health. Substances that the liver would normally filter can accumulate in the blood and affect circulation in the Palmer area. The ninth late symptom is night blindness, also known as nickel. In cases of liver disease such as cirrhosis or hepatic steatosis, the liver plays a critical role in storing and metabolizing vitamin A, which can lead to liver problems and the development of opioids. Vitamin A is essential for maintaining eye health. Vitamin A deficiency results from the liver's impaired capacity to store and release the vitamin, which is essential for without sufficient quantities of vitamin A, the retina's ability to produce the pigments required for low light vision is greatly diminished, leading to night blindness.
White nails with late symptoms. The term leukemia for white nails can indicate liver issues such as cirrhosis or hepatitis. Changes in blood composition and circulation are frequently linked to liver diseases. A sick liver may not be able to process and effectively eliminate toxins from the body, which can accumulate and affect multiple systems, including the blood circulation beneath the nails. This is why nails change color. Furthermore, nutritional deficiencies like a lack of proteins and vitamins, which are critical for nail health, cause liver problems. Can result in pale or white nails. This occurs when the majority of a hand or foot's nail appears white and slightly dull. Practically the entire nail appears faded, save for a thin delayed onset of symptoms: swelling around the ankles and legs, swelling in the ankles and legs when liver disease is present, such as an imbalance in the afflicted liver's production and release of proteins causes cirrhosis. Normally, the liver produces albumin. When the liver is sick, the production of albumin decreases, which causes fluid to leak from the blood vessels into the surrounding space and cause edema. Albumin is a protein that helps keep fluid inside the blood vessels. Furthermore, liver diseases can result in portal hypertension, or an increase in portal vein pressure, which can exacerbate fluid accumulation in lower body parts like the legs and ankles. If the condition worsens, it may also lead to esophageal viruses, which could cause significant bleeding. Mental disarray. Reduction in weight. Diarrhea, ascites, and even death, so it's critical that you identify the signs and seek treatment as soon as possible. Even in the presence of scars and fibrosis, hepatic steatosis can be fully reversed when detected early, protecting the liver from damage and potentially stopping the progression to more serious issues like cirrhosis and liver cancer. If you have risk factors for hepatic steatosis but don't have any symptoms, how can you find out if you have fatty liver? The diagnosis is typically made by imaging tests such as an MRI, CT scan, or ultrasound. A small amount of fat in the liver is normal, but when it surpasses 5% of its weight, the doctor notices changes in the images that point to an overly fat liver. Who has a higher risk of having fatty liver? Which risk factors are present first? Fat obesity raises the risk of hepatic cirrhosis, a condition in which the liver becomes overly fat. Excess fat damages liver functions and causes inflammation, which over time can worsen and cause organ scarring. This scarring is concerning because it can lead to more serious conditions, such as hepatic cirrhosis, a severe disease that seriously compromises liver health. And its primary purposes. Second risk factor, type 2. People with type 2 diabetes are more likely to develop hepatic steatosis, a condition associated with insulin resistance, which is a key feature of the disease. Insulin resistance leads to an abnormal buildup of fat in the liver, which negatively affects the liver's functions. This condition may worsen into liver inflammation, which raises the third risk factor for more serious liver damage. Elevated blood pressure. People who have high blood pressure are more likely to develop hepatic cirrhosis because high blood pressure can exacerbate the buildup of fat in the liver. High blood pressure frequently coexists with other risk factors, such as insulin resistance and obesity, which together increase the chance of liver damage. The fourth risk. Component overindulgence in alcohol. Drinking too much alcohol greatly raises the chance of hepatic steatosis. Is the result of the accumulation of fat in the liver cells, which impairs their ability to function and may progress to more serious conditions like cirrhosis and liver failure. Alcohol is metabolized in the liver, causing oxidative stress and inflammation. Fifth cause for concern, sedentary behavior. Sedentarism raises the risk of hepatic steatosis because it causes the body to accumulate fat due to a lack of exercise. And liver inactivity is linked to additional risk factors such as insulin resistance and obesity increase the risk of liver damage. Additional factors include taking drugs such as amiodarone, Dilam, tamoxifen, corticosteroids, and liver fat reversal techniques. First, abstain from alcohol. Reducing or abstaining from alcohol is crucial for liver protection because it damages the hepatocytes, which are the cells that make up the liver, and can cause the organ to become fat, compromising its health and function. You also need to exercise because fatty liver is becoming a common issue. Children's continued physical activity on bicycles, even with inadequate diets, has led to a preference for electronic games over real physical activities. To combat this, it is advised that children engage in walks or other moderate activities for at least 150 minutes per week. Third, losing weight can have a significant positive impact on liver health, as even 5% of body weight can reduce inflammation and fibrosis. And lowering liver fat, which will enhance your general. Fourth, diet for health. Our diet has a significant impact on the health of our liver. Often, eating too little causes fat to build up in this organ, but fortunately, eating a balanced diet can help reverse this condition. Which 5 foods are the most harmful to your liver and should be avoided at all costs? Foods containing fructose. First, if you have a fatty liver, I want to be clear that corn syrup and fructose, which are found in sodas, are the main culprits that cause fatty liver. Fresh fruits are not the biggest of all. Cereal bars, carton of juices, sauce verde, mustard, ketchup, jelly. Second, sugar. To keep liver health, it is imperative to decrease the intake of sugar, including fructose. This is due to sugar's substantial contribution. Third, ultra-processed foods, those in packages and fast food, are all you need to ruin your liver. They increase the risk of developing hepatic steatosis, a condition that adversely affects liver function. Avoid ultra-processed foods. Due to their high concentrations of sugars, saturated fats, and additives that raise the risk of hepatic steatosis, foods are crucial for preventing fatty liver. Fourth, pasta with refined wheat breads. Crackers. Avoiding refined wheat helps prevent fatty liver as it can quickly increase liver fat. Raise blood sugar levels, which can lead to insulin resistance and the buildup of fat in the liver. Fifth, oils from vegetables. The diet of today is high in omega-6 fats, which cause inflammation, and low in omega-3 fats, which reduce inflammation. It is best to stay away from vegetable oils because many of them contain high levels of omega-6 fats, which when consumed in excess can worsen inflammation and lead to the buildup of fat in the liver. Here are the 6 foods that you should eat in order to cleanse your fatty liver. Fruits. Investigate suggests that fruits, particularly avocados, are useful in lowering liver fat. Glutathione, a potent antioxidant found in avocados, is particularly noteworthy because it not only combats liver fat but also supports overall liver health. Second, whole grains oat bran flax-seed chia are linked to a lower risk of hepatic steatosis and are high in fiber and omega-3 fatty acids. Third-class cruciferous vegetables. Sulforaphane is present in cruciferous vegetables such as cauliflower, broccoli, and Brussels sprouts, which, because of its sulfur derivative, helps lower the risk of cancer and liver inflammation. Fourth-generation olive oil. 3-4 tablespoons of olive oil per day can help to significantly reduce the amount of fat that builds up in the liver, improving liver health. Fifth, turmeric, which has anti-inflammatory qualities, should be taken with a dash of black pepper to improve the body's ability to absorb and utilize it. Sixth, coffee. Tocopherol, vitamin E, and clogenic acid are found in coffee that serves as. If you have fatty liver, take this antioxidant supplement to help prevent liver fibrosis and reduce inflammation in your liver. Thank you for watching, and don't forget to subscribe to the channel. Until next time, in the video.